Hey, welcome to the Explainer. Today, we're diving into a pretty revolutionary idea in medicine. What if we could heal our bodies from the inside out, using their own built-in repair kits? We're talking about a field called orthobiologics. Let's get into it. So let me just start with a question. What if your own body held the key to healing those nagging injuries, torn ligaments, maybe even arthritis? Now, it might sound a little like science fiction, but it's actually the core promise of a really fast-growing medical field. And that field is called orthobiologics. And it's all about harnessing the body's natural healing powers, concentrating them, and then putting them right where they're needed most. Okay, so what does that actually mean in plain English? Well, simply put, orthobiologics uses substances that are already inside your body, your own cells, your own molecules, to help repair damaged tissues. You can think of it like creating a supercharged, concentrated dose of your body's own repair crew. And believe me, this is not some fringe idea. The global market is expected to absolutely explode to almost $14 billion by 2032. This growth is being fueled by a few things: an aging population, more sports injuries, and just this huge shift toward treatments that could maybe delay or even prevent major surgeries down the road. And the kinds of things these are used for are probably going to sound pretty familiar. We're talking about those persistent problems like tennis elbow or rotator cuff issues, the chronic pain that comes with osteoarthritis, partial ligament tears, and even helping broken bones heal up faster and better. All right, to make this all a bit more concrete, let's zoom in on one of the most common orthobiologic treatments out there: platelet-rich plasma, or as you've probably heard it, PRP. The whole concept is elegantly simple: create a powerful medicine from a patient's own blood. So PRP is basically this concentrate of platelets, these tiny little cell fragments in your blood that are just jam-packed with things called growth factors. And the best way to think about these growth factors is like a biological construction crew. When they're injected into an injury, they basically send out these powerful signals that scream, hey, it's time to repair and rebuild right here. So how do they even make it? Well, it's actually a surprisingly straightforward process. First, they take a simple blood sample, just like a regular blood test. That blood gets put into a machine called a centrifuge, which spins incredibly fast and separates the blood into different layers. Then, a second spin isolates and really concentrates that valuable platelet layer, creating the final product that's ready to be injected. And this diagram here shows us exactly how that works. See, over on the far left, you've got the initial blood draw. That first spin in the centrifuge separates it out. You get red blood cells on the bottom, plasma on top. But it's that second, faster spin that's really the key. It isolates and packs down that platelet layer into the final, golden-colored platelet-rich plasma, all ready for treatment. Okay, this all sounds pretty amazing in theory, but this brings us to the most important question of all, right? Does it actually work? Let's take a look at what the clinical evidence really says. Now, to get a really solid answer, researchers didn't just look at one study. They did what's called a meta-analysis, which is a super powerful technique where you combine the data from lots of high-quality studies. In this case, they pulled together the results from 11 different randomized controlled trials, covering a grand total of 851 patients with osteoarthritis. And the headline finding? Well, it was clearly positive. The analysis found that PRP led to a significant improvement in the WOMAC total score. Now, that's just the fancy name for the gold standard questionnaire used to measure pain, stiffness, and physical function in arthritis. So in short, there was a real measurable benefit. But here's where things get a little more nuanced. While that overall score for function got better, the meta-analysis did not find a statistically significant improvement specifically for pain scores or for stiffness scores when you looked at them by themselves. This kind of suggests that PRP might be helping more with a person's overall quality of life and their ability to function, even if it doesn't dramatically slash their pain score for everyone. So what are the big takeaways from all this? First, the evidence suggests that PRP seems to work best in patients who are younger than 60. They likely just have more robust healing abilities. It also seemed to work with different dosing schedules. And, this is really important, the side effects were almost all minor and temporary. Things like some localized pain or swelling right at the injection site. And this is where we can actually see the biological effect happening. These are before and after ultrasounds of a shoulder tendon. On the left, you can see the damaged tissue, but now look at the image on the right, just 8 weeks after a PRP injection. That area labeled neocollagen, that is brand new tissue. It's visible proof that the tendon is actually healing itself. So the evidence for PRP is definitely promising, but it's also, well, it's complex. And it turns out these kinds of nuances aren't just a PRP thing. They actually shine a light on much broader challenges facing the entire field of orthobiologics. The fact that PRP seems to work well for some things but not others, or better in certain age groups, that isn't just a story about PRP. It actually points to a fundamental hurdle for all of these amazing next-generation therapies. And here are the big ones. First, a lack of standardization. The PRP you get at one clinic can be totally different from another. That, of course, leads to inconsistent evidence across studies. Then you've got a pretty unregulated market, which allows for some unproven claims. But maybe the biggest challenge of all is what they call donor-to-donor variability. Since the medicine comes from you, your own age, your own health, it all directly impacts how well the final product works. And that makes true standardization incredibly tough. So, with all of these challenges, what does the future of healing actually look like? Where is all of this headed? Well, the crucial next step for the whole field is pretty clear. To turn all of this incredible promise into a reliable, everyday treatment, we need standardized preparation methods, we need better regulatory oversight to protect patients, and we need much larger, more robust clinical trials to figure out exactly who benefits the most and why. And scientists are already working on the next generation of these therapies. One of the most exciting ideas is something called cell-free therapy. The idea is, instead of injecting whole living cells, you just inject the tiny communication packages, things like exosomes that the cells release. This could make treatments way easier to standardize, to store, and to manufacture, which would solve a lot of today's biggest challenges. And all of this leaves us with one final, really provocative question. With all this research, could these biological therapies one day make major surgeries like joint replacements a thing of the past? The potential is absolutely there, and you can be sure the science is racing to find the answer. Thanks for joining this explainer.